So, have you ever heard your mother or grandmother saying that an aspirin a day keeps a heart attack away? Well, I have news for you. That actually, we don't know yet if that applies to women. That study actually was conducted on 10,000 men, and not one woman was included. So, has anyone here taken Ambien besides me last night? Hundreds of millions of Ambien prescriptions have been written over the last 20 years, primarily to women because women suffer from sleep disorders more than men. But actually, women weren't included in that early research either. And so only in the last few years, the FDA said, hey, actually women should lower their dose of Ambien to about half because they metabolize the drug differently. So this may all sound strange to a lot of women in this room. It certainly seems strange to me when I first started learning about all of this. Why wouldn't these clinical trials include women? So the reasoning at the time was that actually women are more biologically complicated than men, and so because of our hormonal cycles, it would skew the results. So thankfully, this was corrected in 1993 when the Office of Research of Women's Health was set up, and so now women are included in clinical trials. But actually, something crazy still was happening. In preclinical research, which is all of the research that they do on mice and rats before a drug actually gets to a clinical trial, so that was actually only conducted on male mice. And so that was actually just corrected this year. So now in 2016, to get grant funding to do research on drug development and disease, you have to include female mice. So I started my business, Maven, 2 years ago. Maven's a platform that's rethinking women's access to health information and services. I started it as an outsider to healthcare. Having worked in journalism and venture capital, so looking at business stories and digital health investments, I knew the healthcare industry is fraught with regulation and misaligned incentives and red tape. And I still, even working in this industry, I'm so surprised by actually how bad it is. But actually, what's been more surprising is learning how often women's health has been left out of the research and policy agenda for many, many, many decades. So this brings me to the subject of my talk today, 5 things that will blow your mind about the future of women's health. We're seeing shifts in the way we're collectively thinking about it, not just for all of us in this room, but for partners and families and even public health. So now that the R&D playing field is leveling, the next 25 years are going to be really exciting because there's tremendous innovation going on in science, technology, genetics, and there's a lot of amazing champions that are really pushing women's health innovation through. So number 1, let's get right into pregnancy. So the world is going to be full of very, very healthy babies. I spoke to one of our Maven practitioners, a reproductive endocrinologist at Weill Cornell, Dr. Brian Levine. So this is what he said. First, there's superior carrier screening technologies. So what that means in English is that before you conceive, you and your partner are going to go and basically get screened for everything that you might be carrying, and then actually they can edit out all of the scary genes that you have, because we all have them. Then there's IVF. So right now, I'm sure a lot of people in this room have friends that have gone through IVF. Maybe you've gone through it yourself. And it's about a 50% completion rate, and we're seeing a lot of twins. So in the future, actually, the single embryo transfer is going to get really, really good, and we're not going to see very many twins. And if you freeze your eggs and if you freeze your embryos early, you can actually have kids at 50. Number 2. We will know everything about ourselves. So we're at the dawn of the personal era of genomics. Again, in English, this means you'll be able to know personally how you metabolize drugs and coffee, how insomnia affects you versus your partner, and also things like whether you have the BRCA mutation, which is associated with a higher risk for cancer. Maybe you've heard of the Angelina Jolie effect. She's famously had her breasts and ovaries removed recently, when her doctors found that she had a higher risk for breast cancer and ovarian cancer. Not only is she still alive, but she's helping remove the stigma for millions of women to get tested themselves, because increasingly this is going to be the norm. In the future, personalized healthcare will be treating you as an individual and not a sum of statistical possibilities. Number 3, you'll be healthier, but with a lot fewer tests involved. Our clinical advisor, Naseema Sefi, who's a global women's health internist, says that in general, because of all of this data, there will be fewer misdiagnoses and less unnecessary testing in medicine. Women will have fewer pap smears and mammograms, and when women do have tests, they'll be more individualized and personalized according to race and medical history and really all the many factors that make you you. Number 4, doctors will not be the primary fixers of our health problems. The main drivers of disease will actually be the lack of prevention. So you won't be going to your doctor as much. You'll be seeing more allied health professionals and paraprofessionals, which are nurse practitioners and RNs and physical therapists and mental health providers. So obesity and stress and addiction, a lot of these, for instance, are lifestyle diseases that can be helped with a little bit of human coaching and a lot of the personalized apps that you're seeing on your phones to help some of these diseases. Number 5, healthcare will come to you. So this is where Maven comes in. Instead of you trekking out for your healthcare, it will come to wherever you are. So today on our app, we have a network of hundreds of doctors, nurse practitioners, midwives, mental health providers, physical therapists, nutritionists, lactation consultants, doulas, you name it. Our practitioners write college girls prescriptions in their dorm room for birth control. They help women navigate fertility treatments in private and at home from the comfort of their bedroom. Our practitioners help treat midnight breastfeeding issues and handle postpartum depression. And they can even peer inside a cabinet to see the truth behind diet. So that's version 1. That's what we have today. Where this industry is going is that even there's going to be a lot more data collection too outside your doctor's offices. So we have plans soon to integrate with a blood diagnostics company so that not only can we e-prescribe, but we can also order blood tests to get to the truth behind what's going on. And with so many connected devices like thermometers and blood pressure monitors and devices that track heart rhythms, people can be revealing their real-time data at home about themselves so that a more complete picture can be presented. Maven's mission is to empower the female patient and the health and wellness providers we work with, which, by the way, are 98% female themselves. We want to see our wonderful health and wellness providers building relationships with their patients again, which leads to better care. We want to empower women to get what they want out of the healthcare system in a much more convenient and trustworthy way. After all, despite having so little regard for women's health and healthcare, women actually make 80% of all healthcare decisions in the US. So we are the most important decision makers in this very dysfunctional industry. So to end, I'd love everyone to experience Maven. We have a table over here, and you can see what it means when healthcare becomes more personalized and tailored to you. We put cards in your gift bags, and you can have a VIP appointment and a VIP code. And even if you're not sick, join our community, meet one of our providers, and ask that question that's been nagging you for ages about things we don't like to talk about. Thank you.